The powerful thing about this kind of show is that it helps you to understand that regardless of what you're going through, your circumstance or your condition does not dictate your destiny. You can make a change in your life at any given moment if you're serious enough. We talk about this thing, revolution. The wonderful thing about revolution is that revolution was birthed out of timing and desperation. Go through all of world history. Every revolution took place because it was time and people were desperate to make it happen. If you want to make a personal change, a revolution from within, you got to be desperate for it. You got to want this thing more than anything else in your life. And the timing has got to be right. Life Matters shows you how to connect the two.
The women on this show are awesome. And I don't say that just because I love them, but because they are very, very special. They are a combination of professional women, but also women who have their own life issues, and they're honest and they're sincere. And so they're here to share their personal experience and also to give you the benefit of their expertise. I mean, who would love to have an OBGYN, you know, as a best friend that they can talk to about the issues that they're going through, or someone who is a counselor and who's dealt with a myriad of health issues and psychological issues. And that's really what we offer. We're real women, but we also are professional women, and we're here for you.
My job is to reframe people's life stories and to help them maximize their options. And I do that by educating, admonishing, edifying, treating in 3 different venues: psychiatry, therapy, and anti-aging medicine. And I give them all I've got so that they can go out my door and be all they were meant to be.
I think one of the primary complaints, or the chief complaints that I see is depression. And oftentimes I find that women feel like they're not doing enough for their families. They worry. In this economic situation, we have families where the husband, who was at one point the sole provider, has now lost his job, or the mom has now lost her job and she doesn't know how to take care of her children.
What I feel is missing in television for women today is I have a 16-year-old daughter, and the images that she sees on that screen are images of perfect bodies, perfect hair, perfect makeup, and not a lot of intellectual conversation, not a lot of wisdom, not a lot of knowledge, not a lot of anything else but just how someone looks. And it's frustrating to me to see that all the time. When I was young, I used to love watching it too, but now that I've matured, I see what the vast majority of people are missing, what women are missing out there, and that is a positive role model, and not just how someone looks, but how they are on the inside. That's something I have taught her from when she was a little baby. I said, make sure you can be beautiful on the outside, but if you're not beautiful on the inside, you really don't have anything.
As a woman, what I need, and I feel that other women need, we need to encourage each other. We need to be each other's, to come and talk to, give good advice to. Every now and then when you're walking down the street and you see someone, at least me living in New York, and I see something I like, I say, oh, you know what? You look good today. And they don't expect that. We need to definitely encourage each other to be the best that we can.
The biggest emotional thing that I see with women that I treat are issues about their sex life. It seems to be no matter what their age, no matter what phase of life they're in, no matter whether they're married or they're single, they all want to know, why am I not interested in having sex and what has happened to me?
In my world, sex is really about the aftermath of something happening bad. You know, I mean, it's like there was sex and then something happened. So my world is all about fixing stuff, you know, like someone got an infection or someone became pregnant or something like that. And there's also, of course, drama around it, whether it was that I was having a relationship with somebody I wasn't supposed to be with. And it's usually a kind of a bad thing in my world. What about you, Tammy?
Yeah, the exact same thing, Winnie. And it also varies depending upon upon the age of the patient. You know, you get a teenage girl who's not supposed to be having sex, and, you know, is my mom or dad going to tell? What am I supposed to do to protect myself? Then you move into your 20s, and it's more about, well, you know, I just can't get enough. Where am I supposed to find, you know, Mr. Right? Then it moves into, now I'm trying to have a child, and I want to get pregnant, or, you know, the challenges of infertility. And then inevitably you get the magical question of, why aren't I having sex? Why don't I ever want to have sex again, as, you know, people tend to age. So I see a lot of changes within the subject of sex, just based on the age.
Yeah, I think age has a lot to do with it in terms of whether it's a good thing, whether it's something you want, whether it's something that you really don't want. It's funny, when you're young, you're real curious about sex, you know, and you're kind of, oh, I really want to try that out. I don't know, that looks really kind of interesting. And unfortunately, I think a lot of girls wind up becoming sexual because what they're really looking for is affection. Right. And they have to sort of trade it off, you know. The guy wants sex because he's just so driven to be sexual, and the girl wants attention, and so she sort of
she's willing to compromise on that.
Exactly. And then, unfortunately, sometimes bad things happen because we all know that that whole context is wrong for having sex. And then when you get married or when you're older, I think a lot of women find themselves sort of putting up with sex, you know, because they're just kind of, yeah, okay, that's my job, you know, and especially when babies come, you know, then it's like it's all about the baby. And then I have a lot of male friends that complain because they're like, my wife won't have sex anymore. You know, all she wants to do is take care of the baby, and I need to have sex. I really do. I'm like, well, don't look at me. I mean, you know, you know, you need to go talk to her. You know.
Now I see similar. You know, I have married couples who are now Christians, and you have the husband who said, you know, before she became a Christian, we did everything, anything, we did it anywhere, we used toys, and now she just wants to do the missionary position. I can't get her to experiment anymore, and that becomes a problem. And then we also have women who have had issues. Maybe they've been raped or they've been molested, and they just can't seem to enjoy sex, and that becomes a problem. And the other one, which sometimes can be fascinating, is when I have the elderly. Elderly women, and I'm talking 75, 80, who says, I really am thinking about divorcing my husband because I need more sex. And I have to tell you, it takes everything in me to stifle the laughter. You know, because when you see a lady that's 80 come in and you ask her, what is the presenting problem? And she says, I need more sex. No, seriously. And she's very serious. She says, I really want more sex, and my husband's stuff is not working, and he doesn't want to take the pill. I've bought him the pump. He doesn't want to use the pump. I mean, first you have to get past this person, because
like visual. You're
you're thinking. You're thinking.
Like, no, Grandma.
And then the last thing that I deal with, which I think is very, very hard, is when you have either the man or the woman who is addicted to porn, and then especially sometimes I have with men who now wants the wife or the girlfriend to perform the acts that he sees in porn, and that's very difficult.
Diamonds, cash would be great. I personally would be real big on a Maserati. That would be very helpful to me. And I'm pretty sure that if I had all of those things, I can assure you I'd be pretty happy. But all of that being said, I think that the things that women really care about have more to do with support, encouragement, sisterhood, feeling like they have someone that they can talk to. And of course, that's always Christ, but just in our everyday lives, someone who they can trust, someone who has their back and who's going to look out for them.
What I feel is missing in the lives of the women I encounter is a lot of them is love. They don't feel loved. They don't have love in their life. They don't have someone who respects them, and they just don't have that feeling of belonging and that feeling of purpose. I see that all the time in the work environment. I see that even from a church environment. Women just do not feel like they belong or that they have love.
I think the essential needs of anyone, women specifically, is to have purpose, a sense of purpose, direction, and a passion, a good sense of who they are, a good sense of self, and the ability to have lots of humor in life.
But you know, the diamonds do a lot. They help.
My son is 24 and he feels rejected, and that's because his father is not in his life. We try to make our marriage work. That's where I said, you know, it's another topic. Coming from two different backgrounds and two different cultures and two different religions can really put a strain, even though you discussed it, on a marriage, and we had to break ties. And he remarried. You cannot reject your children. You have this son, you need to be in his life, because even though no matter how much I do and how he can't move forward, because he wants daddy to tell him, you've done a good job, son.
You know, you're the mother, and you may think that you're all that and a bag of chips too, and that you have all the answers, and that you can teach your child every perfect behavior. But when you have children, they need to have that father in their life, and that is a role model that they're going to. It's going to place indelible images in their brain. It's going to affect the way they conduct themselves. So no matter how good a mother you are, you are unable to provide all of that.
It never really heals. But you know what, Janet, you made a comment to me yesterday that still sticks with me, where you said that a woman cannot raise a boy to be a man.
Cannot teach a man, a boy how to be a man.
You can raise him, but you can't teach a boy how to be a man.
Right.
And I thought that was a pretty profound statement. And unfortunately, there are hundreds of thousands of women trying right now.
Not only that, I will say this when it comes to fathers. Again, because I have a son, and I've been married, I've been divorced, and I've gone through bitter divorces and bad relationships, both to mothers and fathers. Fathers, when you divorce the woman, or you break up with the woman, you never divorce or walk away from your children. But equally as important, oftentimes women are angry with the spouse or with the ex-husband, and now you keep your child away from that father. You are doing that child an injustice. Yes. You can hit, and I say it when they come to see me, I say to mothers, you know, I say, love your child more than you hate the father. Yes. Because ultimately the child suffers. You know, there's an old saying, when two elephants fight, it's the grass that suffers. And in this case, the child is the grass, you know. I'm going to tell you this, Sean, my sister and I, perfect example. My sister, when my dad and my mom divorced, you know, my dad had a new family. And I look at my sister and I, and we are two very different people. And this is a perfect example. I grew up with very, very low self-esteem. My dad was not there. And we lived on an island. The Virgin Islands, and it's not very big, so I could see my father. But when I look at my sister, whom I just absolutely love, my younger sister, she has a sense of self about her, and it comes from my father. She was my dad's princess. Now, they told me when I was younger, I too was my dad's princess, but I was 2 or 3 at that point. But my sister grew with him, and I have to tell you, my sister's one who would say to a guy, look, thank you for the compliment. I appreciate what you're doing, but you can't afford me. And that comes because she, a long time ago, she understood who she was, and it had a lot to do with my father.
You know, where there's an absence in the home of a father, for a male child, he has a gaping hole in his soul.
Yes.
And at age 11, a male child does not, a mother's voice pales, because he wants to know what it is to be a man. Exactly. The absence of a father in a woman's life leaves a gaping hole.
Her whole life looking for daddy.
In a different way, because then she's looking for love in all the wrong places.
Right.
She's looking for validation. She's looking for to be shown how it is that a man and a woman interact, because she's missing the interaction of the mom and dad, and she's missing that whole piece.
But she needs to be adored by her father. I mean,
Absolutely.
he's the first man in her life. He needs to adore her. Absolutely. When
Can I
he's
just
not there,
add
it's
something really
horrible.
quick, though? I know you're talking all about divorced families, but I came from a very nuclear family. My mom and dad were married for, 20-something years before my mom passed away. And my dad was a very present father. However, he never really gave me many compliments. He was never very expressive in his feelings or in his discussions with me.
So he wasn't emotionally available to you.
So I grew up not feeling that. So I sought that type of validation from boys, men, whoever would give it to me.
Absolutely.
That's where I sought it from. So I know you're talking a lot about divorce, but even in a nuclear family, if that father is not there emotionally, it can also lead to that same type of thing.
As if he weren't there in some ways.
Exactly.
You know, being an ER doctor, I see people when they're in a lot of trouble and things are really bad. So sometimes when I'm like walking along the street and I'll see a child that's laughing and healthy and happy, I'll just tell the parent, you know, you're so blessed. Your baby is so healthy. You just have no idea how blessed you are. And so I think the thing that I do is that I love to just sort of lift people up at a moment when they don't realize just how blessed they are, just to kind of help them know, you look great today, your baby's beautiful, you should be so grateful, God has just smiled on you.
In the moments when I feel the most stressed, when I feel the most torn in 100 different directions, try to take half a second to step back and look at the big picture. Why am I there? Why did God put me in this position at this exact moment? What are my priorities at that moment? And then just click through the list. This is the first thing I have to get done. This is the next thing I have to get done, and approach it from the most common sense, basic way that I possibly could. That's what helps me.
What you really need to understand about hospitals is that you're walking into nothing but germs. Everything that you touch, everything that you see, no matter how hard a hospital tries to disinfect, there's germs everywhere. And if you are sick and in the hospital already, your chance of getting a worse infection or an infection is great. So it's key that you make sure that everyone that walks into your room, whether it be a physician, your surgeon, the nurse, anyone, that they wash their hands. You would be amazed at how many people do not wash their hands, how many doctors take off their gloves, walk out the door, go to the next patient, put on their gloves. Gloves are great, they're a protectant, but they still don't get all those germs off your hands. The other thing I see a lot in hospitals and have seen is surgeries going wrong, or things happening in the OR that you don't expect to have happen, and the family's sitting outside and no one's communicating. It's important, if you're a family member waiting outside an OR, that you are in constant communication with the people that are in charge of your loved one's care. Be a pest. Don't sit back and not say anything, because that's what happens a lot of times. Something's going wrong in the OR and the family members are the last ones to know.
The problem that I have with the healthcare system and people who worked in corporations where I've worked, how do you not take advantage if your employer is paying for your medical care? Okay, and it's not coming out of your pocket, and you don't go for an annual checkup. I got a problem with that. I have a problem with that when I lost my health care coverage, my COBRA, because I had been out of work. And I honestly, I couldn't afford to pay it. It was a lot of money. And then I had to find myself going in for retina surgery. And thank God, I had the hospital worked with me, and somebody in charity picked up my surgery last October. If you're working somewhere and your coverage is being taken care of and you just got to maybe put a percentage in, like some of these city, state, and government workers who are complaining and they're only paying a percentage, I think you need to do that. And not only do you need to do that, you need to make sure that your hiney is at your doctor's office on an annual basis to get that checkup. You should not wind up in the ER with something that's not necessary when you could have had that taken care of prior to. It's called be responsible. And that's something has to be fixed within the system and within the minds of people who are out there, because they're not doing it. How dare you? Well, what system are we talking about? We're talking about the HR welfare system, because I have a problem with that system. How dare you come into a hospital or to see a doctor or anybody and flash your benefit card like you really paid into that, okay, with an attitude of I'm privileged. No, I'm very sorry. But what has happened, this particular welfare that they have put forward has made generations of people ignorant to thinking that this is what they're supposed to have. And it's totally not. Then what the welfare system has done in this country has gotten with agencies, and they work together hand in hand to keep people in a certain place. If you look at how much money they're giving, who can live off $200 and something a month? And where can you live to pay your rent? Because they're only going to give you $200 to pay your rent, and then you're getting $200, maybe $150 per kid. And the one thing that I found out was that if a woman has 4 children in the welfare system, they'll go after the 5th baby daddy. Come on, really? Let's educate these women and some of these young men and tell them, no, the system's not good. If you look at where they are, they're keeping them all in one place. Just wake up.
We are missing from daytime television, okay? I mean, can I just say that? I mean, we are missing, me and my girls, because we are real women, and what we talk about is what really women want to hear about. There are so many role models, quote unquote, on television that are really so unrealistic. And seriously, if we really believe that we needed to look like most of the women that are on television, we'd want to commit suicide. None of us look like that. We want shows on television that are real women talking about real topics, and not these fairy tale made-up people that are completely unrealistic. We're not buying it, ladies and gentlemen, in case you didn't know, and that's what needs to be on TV today. You know, I gotta tell you, that old adage that your mom said about wearing underwear, clean underwear when you go out, it's true. You really should wear clean underwear when you go out. Trust me, speaking as an ER doctor. Here's a word to the wise for men. If you're being treated for a sexually transmitted infection in the emergency room, you shouldn't ask the ER doctor out on a date.